Hi, I'm making this video today to bring awareness to the mental health system in Niagara and to bring awareness to our community and shed some light. I think this probably is going to be one of the most important videos that I ever post on my YouTube channel. This is the most passionate, one of the most things that I'm passionate about in my life is to bring awareness about mental illness and to advocate for those who are suffering in silence and out loud, and to mend the gaps and to protest against the things that are not okay, the things that are happening that are not okay, and that are really that are horrifying, that are happening in our system. So I hope that you take what you hear in this video and you join me and help take a stand against what is happening in our system today. And yeah, so please keep an open mind and open up your heart. Thank you. I'm going to be throwing out some statistics. Mental illness indirectly affects all Canadians at some time through a family member, friend, or colleague. 20% of Canadians will personally experience a mental illness in their lifetime. Mental illness affects people of all ages, educational and income levels, and cultures. Approximately 8% of adults will experience major depression at some time in their lives. About 1% of Canadians will experience bipolar disorder or manic depression. Schizophrenia affects 1% of the Canadian population. Anxiety disorder affects 5% of the household population, causing mild to severe impairment. Suicide accounts for 24% of all deaths among 15 to 24-year-olds and 16% among 25 to 44-year-olds. Suicide is one of the leading causes of death in both men and women from adolescence to middle age. The mortality rate due to suicide among men is 4 times the rate among women. Almost one half, 49% of those who feel they have suffered from depression or anxiety have never gone to see a doctor about this problem. Stigma or discrimination attached to mental illnesses presents a serious barrier, not only to a diagnosis and treatment, but also to acceptance in the community. Today, approximately 5% of male youth and 12% of female youth aged 12 to 19 have experienced a major depressive episode. The total number of 12 to 19-year-olds in Canada at risk for developing depression is a staggering 3.2 million. Once depression is recognized, help can make a difference for 80% of people who are affected, allowing them to get back to their regular activities. Mental illness is increasingly threatening the lives of our children, with Canada's youth suicide rate the 3rd highest in the industrialized world. Suicide is among the leading causes of death in 15 to 24-year-old Canadians, second only to accidents. 4,000 people die prematurely each year by suicide. Schizophrenia is youth's greatest disabler, as it strikes most often in the 16 to 30-year age group, affecting an estimated one person in 100. Surpassed only by injuries, mental disorders in youth are ranked as the 2nd highest hospital care expenditure in Canada. In Canada, only 1 out of 5 children who need mental health services receives them. Almost 1 in 10 Canadians has post-traumatic stress disorder. 2% of adults, mostly young women, suffer with borderline personality disorder, myself included. to express how uneducated individuals are with this illness, I do hear many times people asking me if I have multiple personality disorder. No. The answer is that is a completely different illness. There is a high rate of self-injury without suicide intent in borderline personality disorder, as well as a significant rate of suicide attempts and contemplated suicide in severe cases. Patients often need extensive mental health services and account for 20% of psychiatric hospitalizations. Yet, with help, many improve over time and are eventually able to lead productive lives. There is treatment and you can fully recover. However, and unfortunately, many professionals do not want to work with people with borderline personality disorder because of the stigma surrounding it and the lack of knowledge. 1 out of 10 people with borderline personality disorder will successfully complete suicide. 1 out of 10, where there is possibility of full, complete recovery. Every 25 minutes, a baby is born suffering from opioid withdrawal. According to the Substance Abuse and Mental Health Services Administration, 23.5 million persons aged 12 or older needed treatment for an illicit drug or alcohol abuse problem in 2009. 9.3% of persons aged 12 or older. Of these, only 2.6 million, 11.2% of those who needed treatment received it. 47,000 Canadian deaths are linked to substance abuse annually. In 2007, the police reported rate of drug offenses in Canada reached its highest point in 30 years. Between 1991 and 2007, opioid-related deaths doubled in Ontario. Almost 50% of people with eating disorders meet the criteria for depression. Only 1 in 10 men and women with eating disorders receives treatment. Up to 30 million people of all ages and genders suffering from an eating disorder, up to 30 million people of all ages and genders suffer from an eating disorder, anorexia, bulimia, and binge eating disorder. Eating disorders have the highest mortality rate of any mental illness. Mental illnesses can be treated effectively. So what is the problem? Our society, stigma, and most of all, our system. I've written this to shed light to this matter. This is altering lives, forcing people to suffer in silence and out loud, and killing people. This is life, someone's life, my life, maybe it could be your life, someone you love's life. It's people's lives, women, men, children. It's happening all around the globe, but it is also happening in our community. And we, as members of our community, need to start taking ownership and step up for ourselves and our fellows. I personally am horrified with our mental health system. We hear people badmouth drug addicts, stigmatize and discriminate against mentally ill individuals, bully them. But what part are you playing in help making this world a better place? People with mental illness are people. They are beautiful people. They are no different from any other deserving, worthy, loving soul on this earth, full of potential, wisdom, and brilliance. So I ask, what are you doing to stop the prolongation of the suffering of someone that an individual with mental illness already is going through, or stopping someone from having to suffer for years and years and catch it while it's creeping up early and get treatment for children and youth whom have suffered trauma or are showing early symptoms of something wrong, something starting to accumulate? And what are you doing to step up, take a stand, and not tolerate the absolute nonsense from the Niagara mental health system any longer, and force them to take accountability and responsibility, take ownership for their actions, for their dismissal, their further injury on already suffering, readily fragile and gullible individuals whom are begging for help And when is there going to be enough people to take a stand and force the government to make funding for better services, sufficient services for the needs of these individuals to access? One success story is not equal to the numerous tragic stories of suicide or individuals who would rather die or suffer than re-traumatize or victimize themselves by experiencing another horrific hospital stay where they didn't feel heard or seen or helped, or having to tell their story over and over from having to be changed from therapist due to government cuts and start over, or being stigmatized brutally by police like they have done something wrong, rather than seeing them as someone that's being victimized by an illness taking control over their minds and souls and having empathy and compassion. We need less wait lists that aren't years long so a person can get help when that person needs it, and competent psychiatrists who take time with each patient to see them and hear them, and not just write out a prescription, and therapists whom are specialized, knowledgeable, validating, and compassionate. Because at the end of the day, the truth of the matter is, we as people who suffer with mental illness need to depend on professionals to some extent to be able to find some recovery and healing. Some of us need medication, some of us need therapy, some of us need both, some even more. And if we can't and don't have reliable professionals to depend on, to feel safe with, then we don't have anything to give us any hope. And without any hope, we have no chance at succeeding in recovery. And with that is when we turn to those things to cope. Self-harm, shopping, sex, risky behavior, drugs and alcohol, and ultimately crime to manage the addiction, because we want the suffering to stop. We could end up homeless, losing everything, in institutions, jails, all because of untreated mental illness. And then when none of that is sufficient, you come to your end of your rope and suicide. And it can happen fast or it can be gradual, but it ends up there if something or someone doesn't intervene. And suicide does not need to be an answer when there already is an answer. There just needs to be willing participants to pull up their socks and do their jobs that they are being paid for. And do it properly. And kind human beings driven by love, because I truly believe that's all we have, and without love, all we have is hate, and with hate, we have nothing. You may be asking yourself how this has anything to do with you. Please ask yourself how it has something to do with you instead. It's easy to do nothing, say this isn't my problem, but isn't that how we got here in the first place? Everyone leaving it up for someone else to deal with? And isn't that why every year numbers are staggeringly getting higher? You are a part of this just as much as I am and everyone else. We are all a part of damaging this world and bringing it back together, healing it and each other. We all have choices we make, and each choice we make either moves towards grace and healing or destruction and hate. I am beside myself that these professionals in the mental health system are being paid to dismiss and injure already injured individuals who are just pleading to be helped and be safe from themselves and are being denied that. Even more beside myself that I am sure that the law is that you cannot be discharged from hospital as long as you are still actively suicidal or unsafe. Even though I have multiple times, and I know many who have too, I have experienced my own horror stories, and I have heard horror stories, handfuls resulting in many taking their own lives, leaving hospital after being released without getting adequate and proper help. If Niagara cannot help, then they need to transfer whomever somewhere they can. Whomever somewhere where they can. They should not have died, nobody, especially when someone is actively trying to participate and trying to live and trying to get help. And from today forward, nobody needs to no longer die ever again. But that only depends on what happens when you and I leave here today. What you and I decide to do. If we continue to ignore what is happening will continue to happen. But if we could take a stand and refuse to allow what is happening to continue to happen, then maybe, just maybe, our voices will be heard. And for all those that died by their own hands, we can help others live healthy, productive lives with their mental illnesses as survivors, not as statistics. The ignorance and discrimination of the police and first responders, our community, help be the change to end this. Nobody deserves to be in so much pain and not feel they have anywhere to turn for help. Everyone deserves help. Everyone deserves to feel safe in a non-judgmental, caring, supportive environment that they have access to, and everyone deserves to have someone to turn to. The gaps in the system are horrifying. The stigma is sickening. Someone told me before, I laugh, not because it's funny, but because if I don't laugh, I cry. But I cannot laugh. I cry. For me, for you, for everyone who is suffering. For the unimaginable and intolerable aching pain in the bones of an individual that is looking at themselves in the mirror with tears pouring down their face, telling themselves to just hang on one more day when they truly don't want to, hoping that maybe it will get better, but feeling the reality and the darkness so real and raw in their hearts that it won't, and not knowing where to turn anymore because the system has failed them so many times, or they haven't even had a chance to access the system for help because of the lack of services Niagara has to offer and the gaps, and so many fall through the cracks. It's a living suicide. I don't agree with suicide, but I understand because I have attempted and wanted to die so many times myself because my morals never outweighed the demons within me I couldn't tolerate being with any longer. Mark my words though. Whether I do it alone or whether I have others walk with me and help me, I will not rest until changes have been made. I will not stop advocating for those who cannot advocate for themselves. I will not stop advocating for myself. I will not stop advocating for justice, for the rights of those with mental illness to have the best care and treatment possible. These staggering statistics speak volumes. If they haven't said enough, if they haven't spoken to you, I don't know how to reach you. Every day, human beings' lives are being lost to illnesses that we can treat with proper treatment. Lives taken by their own hands. Think of their desperation, their pain, and think of these professionals with these titles in front of their names, sitting behind their desks, dismissing, overlooking, stigmatizing, discriminating, further injuring, and getting paid for it. It infuriates me more than anything I've ever experienced or felt. The Niagara mental health system needs to take a good, hard look at themselves and really change the way they're approaching the care and services in the mental health and addiction area in the Niagara. And the government needs to do more for mental health and addiction in Niagara. I will never associate myself again with them. I will never associate myself again with them by my own will, and I will do all in my power to protest and shed light to this matter in every which way possible. My wish is that you do the same. Please start to speak and don't stay silent. End the stigma. I even hate that word. It implies there's something that mental illness should be stigmatized about, and there isn't. But that is what our society has done. And please, if you know or see someone suffering, hold out your hand and offer love, not hate. Only we can make this world a better place. Only we can help each other. Only us. Please help better our community in this world. It needs you. It needs us. Thank you.